antigen-presenting cells. We'll talk about it. That what are antigen-presenting cells? Neutrophils are not that. Neutrophils just eat up the antigen, pathogen, break it up into smaller pieces, kill it, and throw it. That's it. That's what they do. We'll talk more about it, that what are the actions which happen. Remember the reactive oxygen species? So they make reactive oxygen species, and then they make bleach, they pour them onto the bacteria, and they pathogen or kill them. So innate immune system. Then there is one more very important factor, and that is the macrophage. So this guy is really badass. He is really bad. If you want to stay away from someone, stay away from a macrophage. Just don't go near a macrophage. Macrophage is very, very important. Why? This cell not only is part of the innate system, and not only it kills the pathogens, it actually, see here, it has a fawn of its own. So if you would see here, some cells have their own fawns. So they have a signaling mechanism. They have chemical substances which they release as signals, which then go and activate other things. So macrophages are very important activators of neutrophil, which is part of the innate system, and of the acquired system. We'll talk about that a little later. So macrophage really is a central player of the immune system. If you are doing immunology and you did not know neutrophil or macrophage or the helper T cells and B cells, you actually don't know immunology then. So please remember, macrophage is a very important part of innate arm of immunology. So in this defense city, he's a big cop there. He does a lot of things. But he also helps the acquired system to function, and then acquired system helps macrophage back to become further active and do more functions. So anyways, macrophage is actually a monocyte which has moved from the bloodstream and gone into the tissue as a result of some chemotactic signals coming from a tissue which is in stress because of a pathogen. And macrophage reaches there and is going to go and try to fix things. So macrophage, when a monocyte migrates from the blood into the tissue, it converts into macrophage. And there are various types of macrophages. We have microglia in the brain. We have Kupffer cells in the liver, Langerhans cells, and so on. These are all various types of macrophages living in various tissues. So some of the macrophages actually end up in the tissue, then stick around and live there for a long time. Okay? Then another very important type is dendritic cells. So if you see here, this guy has dendrites. This guy has nothing to do with the neurons. I know that neurons have dendrites too, right? But this guy has nothing to do with that. It's just he has those branches of the limbs. Dendritic cell is also a very important cell of the innate immune system. Normally, dendritic cells are found under most of the skin surfaces and the mucous surfaces and so on. These are the guys who are sitting right behind the walls of the city. The Janeville or the Johnville, right under the walls, are sitting the dendritic cells. They're sitting there, they're waiting. A pathogen comes, they're going to grab it. So that is their function. What do they do once they grab it? See, if you see here, this guy has a little burner of his own. Macrophage has a burner of his own. Dendritic cell has a burner of his own. These are cells which are phagocytic cells. They eat up the pathogen, then they put it in a burner and they break it up. The question is, what do they do after they break it up? So neutrophil doesn't care. He's broken up the bacteria, he's going to try to digest it or throw it out. That is a neutrophil. Not a very responsible guy. He looks at something, he attacks it, he finishes it, but he throws it out. He throws the trash out as well. These two guys are much, much more responsible. So these are like cops who are going to arrest the criminal and bring it to the justice system. So what they do is, well, there is just one thing which is bad. Not only do they arrest the criminal, they break it up into smaller pieces and then bring those small pieces back to the justice system. So dendritic cell's job is the same as well. As soon as it eats up phagocytosis, a pathogen, breaks it up into multiple smaller pieces, then it would stick them out. It's a show-off. It is going to stick it out and say, hey, look, what did I find? And then run around in the whole world and try to show it to everyone saying, oh, look, what did I get? It's a fun stuff here. And what would happen is some of the cells would then recognize that, oh my God, he's holding a foreign substance. And then they would become active and try to kill the pathogen. So the neutrophil is a phagocytic cell, but not antigen-presenting cell. A macrophage is a monocyte which has moved from the cell, from the blood into the tissue, and now he has become a professional cell, and he is going to pick up the pathogen, eat it up, break it up into pieces, and then put those pieces out in his hand, saying, look, what did I find, and take it to the lab where there are soldiers sitting and trying to figure out how to kill these pathogens. So remember, this is our body. This is the Jane wheel or John wheel. These are the defense mechanisms in there. These are people who are sitting in there. They're little cells, not people. They're sitting in there and they're protecting us. Okay. So dendritic cells' function is also to protect us by breaking up the bacteria and then bringing it to some other higher authorities.
Like this video and smash that subscribe button as well, and make sure that you hit the bell button and get the notifications for the new videos in the future.